These include often abnormalities in their blood counts, particularly when their counts actually drop and are very low. And this can therefore manifest as low platelets and cause an increase in bleeding, low white cells, which can cause a higher risk of infection, or low red blood cell count, low hematocrit, which can cause anemia and make patients tired and fatigued. Moreover, over time, patients develop often what we call constitutional symptoms, where they feel fatigue, lack of appetite, and a true overall loss of energy, which is particularly troublesome. And then in the longer term, we watch for more serious complications, including the chance that their disease can progress and become more difficult to treat, or even progress to a more aggressive leukemia. We have a different set of medications for different things, including, for example, JAK inhibitors like ruxolitinib or Jakafi, which can be used to treat the symptoms, particularly the constitutional symptoms, the big spleen, the things that make people feel bad. However, they don't work as well for the low counts, and for that we use other medications, we use blood transfusions, we use erythropoietin. And so we have to use a sort of individualized approach for different patients depending on what the primary problem is that they're suffering from.
So in regard to managing side effects and complications, a key is that you need to be proactive and communicate with your team. Your team is not going to know what is going on with you and your questions, your concerns, and your physical symptoms if you don't have an honest, open dialogue with them. This includes everyone from your nurse, your physician, your case manager, your social workers, and other resources and staff that are involved in your care.
As soon as a symptom arises or there's anything you have an unsure feeling about, it's important to talk to the doctor, the nurses, the team that's providing your care. Sometimes patients are afraid that if they notify the doctor about a symptom, they'll affect their treatment. They may miss a dose or they may change the treatment. And actually that doesn't happen often. In fact, the sooner you can let us know about a small symptom, it's easier to manage than waiting until things progress and they become more complex and difficult to manage.